Okay, hi everyone, and welcome to today's webinar, which is Consumer Research, the Testing Checklist. So before I start, this webinar is being recorded and I will be sharing the recording after the webinar. There's also going to be the opportunity for question and answers at the end. So please feel free to put any questions in the Q&A box. But I also encourage you to use the chat boxes. I think it's really great as we go through, if you kind of share your thoughts and opinions, you can get chatting to each other and really share some experiences maybe that you have and see if any questions come out of that as well. It's really nice to be kind of interactive with these things. And I think that a lot of what people are questioning and thinking, a lot of other people have the same questions. So it can really generate some good things there. So this webinar, I took part in a workshop not long ago, and I had to make a sort of handout. So I did a consumer testing checklist, and I thought it would be a really helpful webinar to share. So whether you're doing consumer research already, or whether it's something that you're looking to do, it will kind of go through all of those main questions I get, but also what the best kind of practice is as you go through a consumer research study to make sure you get the most valuable data, essentially. So just to give you kind of an overview of the agenda, I'll be going through a summary of consumer research. So if you haven't done it yet, it will give you a bit of an overview of what that is. We talk about deciding research objectives. I'll be going through a case study as we go through each step as well. So it kind of puts it into context a bit. So with that, we'll have things like choosing the best methodology, selecting the panel, what test conditions you need to think about. I've got some notes on questionnaire design and the best practice for that, how you prepare your products, and then how you can present the results. So it's a really nice overview of the whole start to finish process, and I hope that it will be really helpful. So for those of you who don't know me, I'm Carys and I'm the Regulatory Director at 18 Global Research. So I really focus on regulations that affect things like the cosmetics industry or other FMCG categories, and also advertising regulations. So making sure that our data can be used in all of your advertising for things like claim substantiation, but also that generally our research is absolutely globally compliant, and that we're kind of providing you with the best service possible so you can use your data. So to give you kind of start things off, we can look at what consumer research is, again, for those of you who may not have conducted it before, but also a little recap maybe for those of you who are currently doing consumer research studies. So when we're talking about consumer research, we're really looking at the consumer's perception of a product. So it's a general type of market research, so getting an understanding of your consumer, but a lot of people use it for claim substantiation as well. So when we're looking at claims, we're not thinking about these measurements, not necessarily anything that's kind of more what we call scientific, I guess. It's all scientific, but kind of measurements and instrumental tests and stuff like that. We're really just focusing on what the consumers can perceive themselves. So what they can feel, what they look about the product, what they think they look about after using it and things like that. We generally conduct them as in-home studies. So we send out products for people to test in their own home, use it exactly as they would if they were to purchase it off the shelves. So we give them the same usage directions, everything like that. And essentially we're reflecting the actual conditions of the product in use. So again, when I'm saying about these claims, it's a really good process to have in place, even if you do have instrumental studies. Because, for example, if we were saying something like it makes you look younger, we could obviously use an instrumental study to say that the wrinkles are reduced by a certain percentage. But do people actually think they look younger when they're using it? Are people giving them compliments? All of this kind of thing. So it's really helpful data to get for your product development. It also really helps with things like undesirable events. So if you are getting any reactions to your product, obviously when you do a safety test, there's a really small amount of people that you're testing on, so you can get a general idea for it. But once it's kind of had that safety test, it gives you a really good reflection of what would actually happen if you sold your product. So if we send it out to 100 volunteers and one person has an adverse reaction, we might be able to kind of say that, well, that would replicate a much larger scale when the product goes onto market. And it's generally kind of less sort of serious undesirable events as you would have in a safety test necessarily. It's also a part of the EU cosmetic regulation that you need to have some kind of safety data that's kind of about actual use as well. So it's really covering you for that as well. Generally, products are going to be assessed individually, but they may also be compared. So you might want to do a benchmark test against your competitors, or you may want to test against other formulations. Consumers can really say which is their preferred option. So you really get that feedback instead of kind of what the performance is. Like I said, it might be that one reduces the wrinkles more, but actually, do people like using it more? And that can really help again for product development there. You may need additional evidence. So as I said, things like instrumental studies, often there are studies that we would do sort of both on. So do some instrumental studies and consumer research, and some we can just do consumer research for. So yeah, you can always ask us if you're not sure, and we'll always be able to help you with what the best evidence is. So why conduct consumer research? So you kind of get the overall idea of what we're actually doing. But I've already mentioned claim substantiation, and there's some other reasons you might really want to conduct it. Generally, as I say, it's a huge part of new product development. It helps you make decisions about the products that you're developing and letting you know if you're going the right direction, wrong direction, getting general feedback, and really targeting your key consumers and making sure the products you're developing suit them, what they want to purchase. So we can do product and brand perceptions with that. Generally with claim substantiation, we're looking at unbranded products, but you can also do brand perception studies as well and get a really good feel for how your brand will be perceived by your target consumers. So sometimes we do things like an online survey, which might have pictures of the brand and stuff like that, and then follow up with a blinded product study so we can get a bit of feedback overall. So we can really combine studies as well to make sure you're getting this overall feedback from your consumers. I've already mentioned about kind of benchmark testing and reformulation, but that is a huge part of it as well. A lot of it can be about investigating new markets, and that is the case study I've chosen today. So if you already have tested your product or you're selling your product in one certain country and you want to launch it and be global, you can get some really good feedback as well and see if you're going the right direction with those new consumers. It could also be new categories of consumer. So I don't know, maybe you're a cosmetic brand that already does things like skincare for adults, but actually you want to launch a baby range. That's the kind of thing we can investigate as well. You can also gain other marketing materials, so things like testimonials and reviews or photos and videos. These are really great to go into your kind of overall marketing campaign when you do launch. And again, I've got some really good examples of testimonials in the case study. So photos and videos as well, sorry. You can also get things like feedback on the packaging, as I mentioned, brand perception, and also things like establishing your price point, which is also a huge thing when you launch into new markets, because obviously economies are different in different countries. So where you might be selling something for a certain price in one country, it might be that you have to change that price bracket for another. So you can get some feedback on what would be acceptable there. I've got some examples of the kinds of claims that we'd be looking at when we're looking at consumer research as well there. So usually things like percentage of people, but also things like 9 out of 10. So yeah, lots of different ways you can word your claims out of it. In terms of research objectives, so this is your starting point for any consumer research study. It is going to guide your entire research. If you don't have clear research objectives at the beginning, it makes it really difficult when you get your data at the end, because you've got all of this amazing data, but you're like, well, what were we actually trying to find out? And it guides the entire process. Every step we're going to talk about throughout this kind of checklist will always come back to your research objectives. I've seen many clients kind of go off piste and kind of go, oh, we could ask about that, we could ask about that. But it's really important to go, actually, how are we going to use this data at the end? Because really, a lot of other things can be add-ons. You can get carried away and kind of go off what your research objectives were. And then by the end of it, you're like, oh, we didn't even ask about that. And oh, no, you can't find out. So I know I'm kind of pushing the point, but it's a really, really important thing to think about. So to determine your research objectives, I've kind of come up with some questions, which is what I would ask a client if they were sort of saying about doing a consumer research study, because you can ask this yourselves, ask it with your team, and it's the best place to start. So usually when we're looking at product testing, you can say, kind of looking at claims in particular, you might say, what are the main benefits your product provides? So this is quite an obvious one, but as I said, you might have a serum that you've kind of made and you've got this amazing ingredients in it that you know do these effects. That's your starting point. That is what the serum is supposed to do. As I said, people can go a bit off piece, and I've had people before kind of have a anti-aging product, but then go, oh, what does it do for skin conditions? What's it do for acne? All these kinds of things. And actually, what we really wanted to find out if it makes kind of things like wrinkles diminish. So there's nothing wrong with getting extra feedback, but really focus on what those key benefits are. Once you've got all of your benefits together, then you then want to think about what the key claims are. So obviously, when you're looking at a product, you could find out it's got, I don't know, a list of 40 different benefits that are all going to be driven, but it's very unlikely when you actually sell your product that you're going to put 40 claims. It would be overwhelming for your consumer to have that many benefits, or well, you can say benefits, but have that many key claims driven to them. So once you've got your key benefits, you could say, okay, the main thing that we want to get, for example, if it was a conditioner, obviously it's going to condition the hair, but the thing that really stands out is that this conditioner makes the hair really stronger. It looks much healthier. That's our key claims. That's what we want to say. So that's the kind of things that we pick out. And then everything else about it, we can obviously include in there as well. But it means if we know what your key claims are, we can design the questionnaire and all of the research to surround really getting those key claims. The next thing to think about is what markets you're looking at. So this is really important in terms of compliance as well with your advertising, making sure we've got the right languages, and again, making sure you've got your key consumer being reflected in the study, because if your key markets are in Asia and we conduct the study in UK, it's not going to be of any use to you. So really think about what those main markets are. When think about when the benefits should be perceived. So essentially this will drive our study duration. So a lot of people sort of say, I've got this product, how long do I test it for? Well, you need to let me know because you know how it's been formulated. So certain like anti-aging products would often be quite a lot longer, whereas maybe a makeup remover would be quite a short study because you just want to find out if it removes the makeup. So if there are kind of benefits that will increase over time, that's where we generate it. I mean, certainly for supplements, we can have 6-month studies because they're ingesting it. We know it takes a while for people to kind of adjust the real benefits they're getting from these products. And if we tested that in a very short amount of time, the data wouldn't be very helpful. It also is important when you actually market your product because you need to say how long the benefits will take. It helps with that, but also in terms of selling products. So if you had a supplement, for example, and you sold 1 month supply, it would encourage people to buy more because they know if they use it for 6 months, that is when they're going to get the best effects. So I know I'm kind of talking about it quite a lot, but there's a lot of things to consider about the duration of the study as well. Always think about where you'll be displaying the claims. Again, the more you think about it in the first instance, the better we can design the research. So if it's pack copy, we could have a look at your pack copy copyright that you want to have on there. And we'll make sure that we've designed a questionnaire around that. If it's going on to social media, we might think about doing some videos to support that. There's lots of things to think about. So again, if you know you're displaying the data, the better we can do with the presentation of it. Is there any other marketing claims you want to get? So when you think about the benefits and stuff like that, is there anything on top of that you want to say? So would people recommend the product? We've done things like mum approved for baby care. All these other kind of big marketing claims that you might want to get. The more we know about them, the better we can do the research. And again, I've said, do you need any of the marketing material in your advertising? It's worth missing on the end there. So again, things like photos and videos, testimonials. The main thing to think about as well, though, is who are your key consumers? So really think about who that is in terms of age, gender. Are you a very inclusive brand? Do you want to have a range of ethnicities? If it's a shampoo, do you want to have a range of different hair types? All of these kinds of things. Think about who you want to purchase your product at the end, and that is who we will select. It's really good to think about being inclusive, but the more specific you are as well, the better, because obviously you tend to have a panel of around 100 people. So if we go kind of crazy on all these different kind of groups of volunteers, groups of participants, it can actually then be really hard to pick up at the end and go, okay, so about 5 people had oily skin and lived in China, but that's not given us enough data to actually reflect and see if they would accept the product. So there's a lot to think about that, but really think about who your key consumer is, and then we can help with how many participants and stuff like that you need on your study to be able to make sure it's significant. So in terms of claims, there's a kind of lots to think about in terms of making that key claim and everything like that. So as I mentioned earlier, when you're deciding what your key claims are, what kinds of things do you want to assess to make sure you're getting the most relevant claim to your product? So always explore your target group. So you might want to do some things like customer surveys, some research, some market research to fully understand what their needs are and what is really relevant to them. So it is really important to kind of always go back to who's buying your product, because at the end of the day, that's who the claims need to resonate with. It's all very well and good to sort of say, okay, we want to say this and this and this about the product, but it might be that it's so general, you're not kind of speaking the same language as your consumer. Claims should be a two-way conversation. So whatever you're kind of putting out there for your consumer, they should be able to resonate with it, should work with them. So think about product experiences that they're having. So obviously when you're doing a kind of consumer test, you might get your main claims from that by going, okay, this is the experience that they're having with the product, and that's how we're going to generate the claims around it. So it can be a kind of two-way thing. And you can also do comparisons with your competition. So think about what claims are out there and how it's working for them. Obviously, market research generally is really good. It is definitely, FMCG industries definitely go on trends. So once one thing is trending and the consumers are liking it, it's really good to go on that kind of bandwagon and make sure you're talking that same language, so you're on the same kind of path as everyone else. Always check your competitors in terms of successes and failures as well. If you know that a brand is kind of been in hot water with the ASA or something like that, look at what claims they're putting out there. I would recommend following any kind of advertising authorities in any countries you're selling, because it will give you a really good idea of what the failures are in terms of compliance, but also in terms of just what hasn't worked as well. So yeah, if you, like I said, if you can kind of see something's really trending with the company, think about that as well. Make sure you're on there, and also always try to take it a step further. So what are they saying that actually if we got the evidence for it, we could also say this. So it should be this kind of like wheel essentially, which goes from product performance to consumer need. What does your product actually do, and what does the consumer want? And that is really how you get the best marriage of your relevant claim. It's a multifunctional task. So again, we've got another kind of wheel here. So what's in it for the consumer? Why would they purchase your product? What is best about your product more than anyone else? But what can the product actually deliver? So you need to think about this as well. So obviously we want to get the best product out there. Everyone does, but these are really congested industries that we're looking at. So make sure you can actually deliver it as well. Does it support your brand? Does it support your kind of messaging? Every brand has a bit of a story, so make sure you're kind of matching up with that as well. If you're a brand that is really into sustainability and things like that, does it all kind of marry up with what your consumer wants and what the product can deliver as well? So really think about what the strategy is when you're going to put out the marketing. Can it actually be implemented with your sales? So obviously think about that, because if you can't kind of back it up and sell it, you kind of go a bit OTT, maybe saying, I want to be a global brand, I'm going to test in every country, but can you actually sell in every country? Is your kind of logistics behind it going to work? And obviously what's really important is making sure it's legally supported with evidence. So that is a lot of what consumer research is for, as we say. You need to make sure that you have some legal evidence behind it and that it can be backed up. Like I said, it's all very well and good saying these things, but certainly I will give an example in terms of hair growth claims. For a lot of clients come to us for hair growth claims, that is something that needs to be evidenced by consumer research and clinical research, and the clinical research side is incredibly expensive. So it's very good to think about all these things, but you need to think about if you can actually support it with the evidence. You need to think about all of these functions all the time when you've got a claim. That is what will make it strong as well. So I'm going to go and introduce our case study now, because I can think about, now we've got our claims and our research objectives sorted out. This is how we would implement it. Sorry, 2 seconds. So we've got an eye treatment duo here, which is from a premium British beauty brand. Now they want to make sure that they have got the product appeal and suitability in their key Asian territories. So straight away, we know we need to test this in Asian territories. We need to make sure that their product performs as well in countries that already have evidence. So we already had evidence in the UK and US, but now we need to make sure that that evidence is also supported in Asian countries and that the product is accepted there. So all their advertising claims need to be substantiated, but they also want to gain testimonials, which will be used in local marketing communications. Obviously, there's a translation thing here. Again, if you want to have local testimonials, you need to make sure you're conducting research in that language so that you can gather the right language as well for what you're going to be selling. So the methodology we chose was an in-home user study, sending products for people to test in their own home, which I've covered. The countries are Hong Kong, Japan, and Korea. So we had a reflection of some of their key territories. Languages needed to be in English, so we can read it and so can the brand. But then we also had to translate it into Chinese, Japanese, and Korean. So it's localized to their language. The claim is localized as well, so they can understand everything, and then we can get those testimonials in the right language. It's a 2-product regime. So we had a day and a night eye cream. They're going to be sold as a duo, so they need to be tested together. So this is a really good thing to think about as well when you're coming up with your methodology. Is this product be sold separately? Is it supposed to be sold in a regime? Are you trying to compare it? This is all really important stuff. The duration for this one was 28 days or 4 weeks. So obviously this has some anti-aging claims in it. So we wanted to make sure we had enough time to get the kind of effects perceived by the consumer. We had to think about some questionnaire time points as well. So we had some feedback before they used the product. So what's their general skin like already? Then we had some time points check-ins at 2 weeks and 4 weeks use. Great thing about online consumer study, in-home consumer studies is they have online surveys. So we're completely open in terms of when we can ask questionnaires. It can be at any time point. So the next thing to think about is the panel. So I really wanted to bring up some of the ASA advice, because one of the biggest things we always get is, what is the panel size for this consumer study? It is something that cannot be pinpointed. So as they've said, I've chose the ASA because I'm in the UK, but generally this is a really good guidance for any country you're testing in. So they're the UK, the Advertising Standards Authority, but really if you're looking at any country, this is really helpful. So obviously all the nature of claims all vary, so there is no set panel size. It is up to you to make sure your panel size is sufficient to support the claim being made. It needs to be statistically significant. So again, we're able to advise that. We know how much data we need to make sure it's a significant claim. And our reports have obviously analysis in there that shows if it's how significant it is. They get a p-value. Won't go into too much detail, but we are able to make sure that it's very clearly significant. So the smaller the panel, essentially, the harder it is to show. So that's the best thing to kind of take home from it. The bigger the panel size, the more significant your data is. So always try and think big. You don't want to rely on small print. I thought that was a really interesting thing they brought up. So obviously if you say, 88% of people said this made their hair look healthy and feel amazing, and then in the small print you say of 10 people, you can't rely on the consumer to kind of go, oh, 10 people, okay, well, maybe I shouldn't rely on it that much. It shouldn't be interpretive. It should just be really clear from the get-go. So always use a representative panel as well, unless you're being specific. So I thought this was really interesting and something a lot of brands are picking up on now. So if you, for example, are selling in the UK and you tested all on Caucasian women, it wouldn't really be a fair statement to say that all women agree with it, because we have quite a diverse, lots of diversity in the UK of different cultures and ethnicities. So it's really important that we have a representative demographic panel to make sure you can make those claims, and it will apply to people that are living in the territory you're selling your product. Don't ever exaggerate the results. Again, that sounds quite obvious, but a lot of people can really get tripped up by that. Again, it might be saying that there's maybe more people than there was, or more percentage agreement, or just generally exaggerating results without having the data to back it up. So really good kind of take home advice there when you're thinking about your panel sizes. Always think about those kind of subgroups as well. I kind of mentioned this earlier when I was saying it's all very well and good to be really inclusive, but then you need to have the numbers behind it to back it up. So if you want to say all ethnicities or skin types, we're going to have to make sure we have enough people in every single group so that we have significant data for you to be able to advertise it that way. So a kind of example of that is that the other thing is that if you do subgroups and you kind of say, okay, well, we tested this on 50% people with sensitive skin, 50% not, and it wasn't accepted for people with sensitive skin, you would have to quote that in your marketing. You wouldn't be able to say sensitive skin, and you'd have to take them out of the results. So in this example, say we had 60 people, half of them had sensitive skin, and the people with sensitive skin said it wasn't suitable for them. We would have to take them out of the overall data. Then you're left with a very small subgroup. So you'd say from a consumer study of 30 women with normal skin in China, for example, the claim would not be significant for advertising. 30 people was much too low for a consumer study. So it's really important to think about the subgroups as well. And if you were to remove data, would you be left with enough data to sell it? Lots of things to think about a panel size. I've got a whole webinar about it if anyone is interested, and I can send that over. But it's a really important thing to think about, and a lot of questions we get about consumer studies are to the panel size that's required. So in this case, we went for all female volunteers because that is their target market. They had 30 to 60 years old because, again, they need to have aging skin, but also be able to kind of go for their consumer target there, and that's who their consumer target is. We had to have all skin types on there. So again, we need to think about those subgroups and make sure that we're going to reflect it. They had to show multiple signs of aging, including deep set lines and a loss of luminosity and radiance, because these are things we wanted to assess as improving by using it. Things like skin lacking in hydration, dark circles under eyes, and under eye puffiness were all a part of what we wanted to assess as well. So obviously, if people aren't presenting those things, we can't really assess it. So we have to think, when I say about thinking about your key consumer, these are really important things to think about as well. Because obviously, if people don't have dark circles under their eyes, well, they can't say it's got any better. So the test conditions, obviously how they need to use the product. As I mentioned earlier, when we're doing in-home consumer studies, we want to reflect the actual condition of the actual conditions of the product in use. So it really should come from what you're going to put on your product when you're selling it. So for this case, we had obviously a day and a night eye cream. So the morning one had to be used every morning, and the evening one had to be used every evening for the 4-week study. Nice and simple. We had some product usage instructions in terms of what they're actually going to put on the pack copy, about how to apply it. It has to be put on eye areas, and you also need to include restrictions for use. So obviously I don't want to put all the safety instructions in there, there's quite a lot, but you need to make sure that you have restrictions for use in there. You can't kind of just assume that people are going to, not put it in their eye or eat it. It sounds very obvious, but again, we need to make sure we have that in there to make sure that, again, that we're kind of insured as well. If we didn't put that on there and someone did eat a whole pot of eye cream, unlikely, but we would obviously be in a bit of trouble with insurance. The next kind of step we're looking at is questionnaire design. So I've just got some generic kind of tips for questionnaire design, because obviously, again, it always generates from your claims and your research objectives and the benefits of the product. But we need to make sure that we have some kind of ideas in mind of how we're going to design it. So we need to make sure that with the answer groups, they're consistent and appropriate. Usually what we do is we kind of present the questions as a statement. So as I've said here, wording should match the claim verbatim. So if we say skin feels soft, obviously you can use that in your advertising to say women agree that their skin feels soft. So that's kind of the best way to design it. Do it as a statement in present tense. Because obviously if you say my skin was soft, it's kind of a bit ambiguous. We're always trying to avoid ambiguity, because it could be, well, was your skin soft before you used the product or after? Very obvious, I know, but again, if we say skin is soft, it makes it really, really clear that it's after using the product. So yeah, we want to make sure that we have the kind of claim as a statement. They agree with it. So when I say about consistent, appropriate answer groups, we tend to use a 1 to 9 scale. So strongly disagree to strongly agree. We can then say that everyone who did a 6 or above has agreed with the claim, and therefore that's kind of our pass rate. So you want to keep it consistent. You don't want to go, okay, we're going to start at 1 to 9, then max it up 1 to 5, everything like that. Not only does it make it confusing for your consumer, but it also makes it difficult to analyze the results, because if one claim had a 1 to 9 scale and 80% agreed with it, and the one claim had a 1 to 5 scale and 60% agreed with it, you wouldn't be able to say, oh, maybe it's because the answer groups were changed. You want to make sure it's really, really clear it's because the claim was different. And this goes the same for all of your studies. So if you are already doing a 1 to 5 scale, carry on doing that, because you want to be able to compare it with your previous research as well. Again, if you had one eye cream, one day cream, same fragrance, but people said they didn't like the fragrance, you want to make sure it's as consistent as possible so you can analyze that, and make sure that, yeah, you've kind of got a bit of comparison there. And it's why we also suggest people do a 1 to 9 scale, because it's what we've always done. So we can compare against things as well that we already have in our system. Obviously, be very clear. Make sure that when I say about making it statements, it does also help with making the questions really, really clear there, because again, want to avoid ambiguity as much as we can. Also include some free text answers, because it's really just good for your product development. And it also gives you kind of a chance, if something is going weird with your data and it doesn't really make sense, if people give that feedback, you really understand it. So we've had it before where products have been overall rated really poorly, and it turns out it's because the fragrance wasn't very nice in the product. So people then had that overall idea of going, actually, I just don't like the product. So we got that in the free text, reformulated the product with a new fragrance, and everyone loved it. So it's a really great way to get that kind of feedback. In terms of what to avoid, the MRS, Market Research Society, put up some really interesting, put these really like 4 major issues that they picked out in terms of what always seems to go wrong and give people negative results on their studies. So what can, basically negatively affect the data. So one thing is the excessively lengthy questionnaires, or a lack of honesty about the potential length. It's kind of unlikely to be a huge thing when it comes to product testing, because you're only going to have a certain amount of claims anyway. What can be annoying is repetitive questioning. So it might be, if you said you wanted to reduce the wrinkles and that, show that wrinkles are reduced. If you ask that after the first day, after a week, after 2 weeks, after 4 weeks, well, no one's going to see it after a day anyway. So by the time they've been asked it 4 times in the 4 weeks, they might not get a good of response as if they've just been asked it when it was actually expected to have an effect. So that's something to really important to think about. But really, the excessively lengthy questionnaires, much more comes from when you're looking at market research. Try and be really concise with your research objectives. Like I said, about going off piste and things like that. When you go kind of down that route, it means you can end up with all of this data that you didn't really need, and it actually affected the quality of the data that you did need. So always think about the length of a questionnaire. Also, make sure that respondents have an opportunity to have their say. So if you said, which of these brands do you like? And then there was obviously 10 brands you listed and no other options, they might go, well, I don't really like any of those brands, but I had to choose one. So it's not reliable data. So always make sure there's sufficient opportunity there. This is also the case when we do the 1 to 9 scale, we have a neutral option in the middle. And that's really nice, because if you go, my wrinkles were reduced, but people kind of go, well, I didn't really notice that they were reduced, but also they didn't really get worse. You can kind of get that neutral option there as well. You don't want to have an excessive classification section. So again, people get annoyed when they're just asked a lot about who they are and what they want, especially if it's not relevant. It's really important to get this feedback if it is relevant. As I said, with our case study, before they used the product, we wanted to say, okay, well, what do you think about the appearance around your eyes currently? All of that kind of thing. But then if we went off to say, okay, well, where do you shop for your products? Whereabouts do you live? What do you do on a Sunday? All of this kind of stuff. People are going to get a bit annoyed, and we don't want to do that. So we want to make sure that they stay happy, so they answer your questionnaire to their best kind of positive attitude. So once we've got the questionnaire design and everything like that, so I'll be able to show some of the questions in the results. But obviously it's all so very different for every questionnaire. I don't want to go into too much detail there. But once we've got the questionnaire design, we need to get the samples from you for testing. So another sort of few bullet points about what you need to think about if you're preparing samples for us. So as I said, if it's claim substantiation, they must be unbranded. This is essential for unbiased data, and a lot of advertising authorities will not accept branded products tested, branded data from branded studies for claim substantiation. So if you want to get a feedback on your branding, that's great, but we need to make sure that we do that separate to the assessment of the product. Obviously, we need to make sure they've passed any relevant safety, toxicological or dermatological assessments that would essentially allow it to be released on the market. We're replicating your consumers' purchasing. So if they're to buy this product off the shelf, they're using it in their own home, they're not having observation. So for a consumer test, it needs to be safe for them to use. Obviously, that can be different for every kind of product. So that's why I've said it needs to be relevant to the product that you've got. Always make sure to assign products a code. So this is great for your reporting anyway. You'll get an image of the product, you get the product code throughout. Make sure it can be matched up really nicely. You can keep a product with the product code on it in your offices. So if you ever come under scrutiny, you can say, yep, it was this product that was tested. The more coding you use, the easier, but especially if you're comparing products, because they're unbranded and we've got blind study going on, it needs to have a very clear code for what your product is and what your competitor product is, or what formulation A and formulation B are, so that we can make sure they're easy to evidence which one was compared, which one was the winner, everything like that. You want to test the products in a container that's the same or similar to what it would be sold in to replicate the actual use. So that's quite an obvious one. We've had it before where people are doing test samples. So we had an eye serum that was quite viscous, and it was supposed to come in a pump bottle. So obviously pump it out, dab it on your eyes. But because it was a test, they were like, well, we'll just put it in small pots. What it meant is obviously to scoop it out, it kind of dropped off the finger and didn't really give the same replication of what the effect would be when it was sold in the stores. So it didn't get very great results from it. So the more we can replicate that, the better. It also gives you a chance to get feedback on that experience as well. Always just supply enough product to last the study duration. Again, that's a very obvious one, but people often ask, how much product do I have to provide? Ideally, a full-size product is always great. The consumers get free products and no other reward from taking part in your study. So if you give them a full-size product, they'll be quite happy with that. But obviously that's not always possible. So it needs to be enough to last the study and a little bit extra just in case. Because again, you'd be surprised how we've had small products sent before. Brands trying to get away with kind of cutting the cost as much as possible, sending as little as possible, doesn't last the study duration, and you end up kind of cutting the study early or having to send out more products, and it's a bit messy. You want to keep it all as smooth as possible. You can ask us directly for label information. Again, I don't want to bore us too much with that, but I can tell you what to put on the label, because if it's unbranded, we obviously need a certain amount of information that will be there to let the consumers know what it is. So once we've got everything set out, we've got our research objectives, we've got our test methodology, we have done our questionnaire, we've got our panel, we've recruited for the study, we've got the samples, we'll be able to conduct the study, and then you get your lovely results at the end. So this comes from our report directly. I've chosen a few key claims that came from the case study, and this is how we get the kind of summary report at the end. So obviously, like I said, we've got the claims in statements. We had an agree or disagree range scale for it. So we've got our statements on the left there, the number of people that were satisfied or not satisfied, and then the percentage of people that were satisfied and not satisfied, because that's what allows us to make the claim. We usually take the percentage out, say how many women it was tested on, and then that can be used straight in your marketing. So this is the kind of most essential thing if you're doing claims that will come out of your report. So we had things about the duo really reducing the appearance of fine lines and wrinkles around the eye. 83% agreed, which is fantastic. The product leaving the skin feeling intensely hydrated, smoothing the appearance of dehydrated and crepey skin. And the multiple signs of aging around the eye area is a perfect solution for it. Lovely wording for marketing as well. So yeah, as you can see, we had some really high percentages, which is fantastic on such a large panel as well, because we had to test across all skin types, different countries. So we had to have quite a few people on the study. And obviously this is the overall they can put straight into their marketing as well there. So obviously I can't show you how they've presented the results because it would give away the brand, but I do have some examples of how other people have displayed their results from consumer studies. So L'Oreal Paris, they've done some claims in there about the skin being deeply hydrated. In 1 week, it feels bouncier, firmer, and more toned. And that's a self-assessment on 155 women. So this is all from their websites. By the way, I've just done screenshots. Charlotte Tilbury, I've got 100% with their wrinkles appearing reduced, skin instantly moisturized, dull skin instantly transformed, skin looking and feeling firmer as well. And as you can see, they've put 103 women tested over 4 weeks. Elemis as well. I've got some percentages of people with their with the skin feeling cooling, having cooling hydration and feeling refreshed. Calm skin is instantly and calmly soothed. And again, we've got an independent user trial with 134 people over 2 weeks. So you can see how easy it is just to lift those claims, go, that's the percentage of people, that's how many it is. And we're going to check that straight on the website. We've got some great marketing there. So there's some really good ways of presenting the results there. Also television, you might want to put your claims on there. So we've got things about from Nivea and L'Oreal and I think Pantene about the percentage of people of how many women have agreed with those. The True Match one was more of a mass market research survey. So that's quite an interesting thing to think about as well. It doesn't have to be a product test every time, but you can do a kind of research survey and say, could you find your shade? And then you can say it matches any shade than any other, as long as you've got the data to back up against other competitors and stuff like that. Again, that would all be part of that test methodology and questionnaire, but it gives you an idea of what kind of stuff you can get out there with consumer research. Also, social media, huge place to be selling your products. So yeah, we've got Augustinus Bader, which has got 98% of people agreeing that the skin feels supple and elastic from a 12-week consumer study. And Elemis again with their superfood range, with 91% of people agreeing that the skin feels gently cleansed, purified, and refreshed. So just some examples there for you about how you can be using this data and displaying it. So in summary, basically always make sure you've got clear research objectives. I think I push that point a lot, but it gives you an idea, as long as you know how you're using that data, if you know that's how you want to use your claims, this is how we design the questionnaire. So this is really how we think about our clear research objectives. A well-designed study in a questionnaire is essential for valuable data. It all starts with the design. If there's anything that goes wrong after that, you can't, once the study's gone out, if the questionnaire and the study is designed poorly for the research objectives, we need to start again. You can't kind of reverse that one. Your data needs to be compliant in the country you're selling the product, so always make sure you have evidence appropriate. Always clearly present your evidence in advertising to avoid scrutiny. The clearer you can be about the advertising data you have, the better it will be for you in the long run if you ever come under scrutiny. So for example, I think Elemis have done a great example there. Independent user trials from 2019, results based on 134 people over 2 weeks. Really nice and clear. Shows it's an independent user trial. It's not a clinical study, says the date, and it says how many people and how long for. That's kind of a really good example there. And also on that, always use recent evidence in your advertising. So by putting the data, makes that really clear as well. But obviously formulations change. They're constantly changing once you've launched a product. Obviously you need to make sure that they're not going to change the data, but usually there's such small changes that it doesn't affect it. But it needs to be really clear. If you've got data from the early 2000s and you're selling it now, it's not really fair on your consumer that they're going to be getting the same product and that it's going to have the same effects. So always make sure it's recent. So just a bit more information about us before I go on to the questions. So we are an award-winning research agency. So we've won things like international business, things like family business, and we're really, really proud of those as well. We are fully compliant with the GDPR, and we have an ISO 27001, which audits us on this process. We have a panel of over 600,000 volunteers, so we need to make sure their data is protected. But also it's really important to make sure your data is being protected as well. We have undesirable event reporting, which I touched on, and that's all made in accordance with the Cosmetic Vigilance Act. We've obviously got full product liability insurance, so it's really important that if you use a research agency, they do. We've got an ISO 9001, which is about our quality assurance. We are a partner to the Market Research Society, who I mentioned earlier for questionnaire design. We get our full training from them, but we also we need to follow their code as a partner even more closely than any member. And it makes sure that our research is ethically conducted as well. You get your regulatory advice. That is what you can come to me for if you've got any questions surrounding regulations to do with consumer studies. And you also always get a designated study manager. So you have one point of contact that will be able to learn everything about your research objectives and make sure that questionnaire and study is designed very precisely so we get them achieved as well. So thank you for listening. And I'm going to go to questions now. I've not seen any come in so far, but I don't know if anyone has anything that they would like to ask. We've got the chat there, but also a Q&A. If you want to put it in the Q&A box, I'll check both. Thank you, Macon. Thank you very much. But if I haven't got any questions, I will put out my email afterwards as well. So when I send out the recording, you'll get my email address. So please feel free to email me directly if you have any questions. I can't see any coming in. I don't want to hold you all up. So I'll move on to close the presentation. So upcoming webinars. So we have not next week, the week after, on the 23rd, essential oils, consumer insights and regulatory considerations. So we'll be thinking about how essential oils are used in things like cosmetics, what are the regulatory implications, but also I'll be sharing some market research I've conducted on consumers and what their thoughts are on essential oils as well. Funnily enough, Macon, who is listening in and has just messaged, will be joining me on the 30th of April for our presentation on reformulating cosmetics, and we'll be concentrating on sun protection this month. So talking about if you are looking at a kind of sun protection product and if you've had to reformulate it at all, what are the processes there and how can we help? And then on the 7th of May, I'll be joined by Karim from Cult Beauty, and we'll be looking at the success of a global market expansion from a consumer research study side, but also from logistics side as well. So also the SCS, just to point you in their direction before the end of the presentation, they have a distance learning course, which is in the essentials of cosmetic science, and that you can look at their kind of link there if you want to have a look at that course. There's also going to be the IFSCC Congress, which we are very proud to be sponsors of, which will be happening in 2022, and you can register your interest for that now. So thank you very, very much for listening, everyone. I hope that's been really insightful. There is my contact information, but I'll be following up shortly on email with the recording. I hope you all have a fantastic weekend, and I'll see you next time.